Good afternoon and welcome to our first Community Water Fluoridation Education Series presentation. Today's webinar is focused on increasing knowledge of the benefits of community water fluoridation. The Louisiana Office of Public Health Well Ahead Louisiana Oral Health Promotion is funded by the CDC to implement the Louisiana strategies to improve oral health prevention and access to care project. Well Ahead Louisiana and Oral Health. Well Ahead Louisiana is a chronic disease prevention and health care access arm of the State Department of Health. Well Ahead connects communities to tools and resources that help improve the health of Louisiana's residents where they live, work, learn, play, and pray. Well Ahead works to create healthy smiles through oral health education by expanding access to preventative dental services. In Louisiana, only 39% of residents receive the benefits of community water fluoridation compared to almost 75% nationally. And dental care remains to be one of other unmet needs for underserved children, older adults, and special needs populations. However, WAL continues to promote and educate on the effectiveness of water fluoridation. We hope to continue to increase community water fluoridations throughout Louisiana. Our efforts to increase fluoridation are executed through several approaches, which can be found in our resources that will be shared later in the presentation. 1.8 million residents are underserved due to living in a dental health professional shortage area in Louisiana. We are proud to begin our education series with a national renowned water fluoridation champion, Dr. Johnny Johnson. Dr. Johnson is a pediatric dentist from Pinellas County, Florida, who is also the co-founder and president of the American Fluoridation Society. Dr. Johnson has delivered presentations, trainings, and testimony about fluoride in numerous states, including Kansas, New York, Pennsylvania, Texas, Wisconsin, and his home state of Florida, as well as in the UK and Canada. Dr. Johnson's leadership role in fluoridation advocacy began after his commission voted to end fluoridation to greater than 700 residents, a decision that was successfully reversed after he worked with others to form a coalition in the Clearwater Street, St. Petersburg, Florida area. Dr. Johnson was a key source of information for the reporters and editors who helped the Tampa Bay Times win a Pulitzer Prize for his coverage of the fluoridation issue. He received his dental training from the University of Florida, and he earned his certificate of pediatric dentistry and Master's of Science from the University of North Carolina at Chapel Hill. This presentation is brought to you in collaboration with the Louisiana Rural Water Association and the Louisiana Municipal Associations. Without further ado, we present to you Engaging Communities about the importance of community water fluoridation webinar. Dr. Johnson.
Thank you very much. I appreciate you having me with you all today. This has been a wonderful ride for me. I'm a pediatric dentist of 30 years, became disabled because of a bicycle accident. And as Michonne said, I had a issue come up in my county, which is 1 million people. Over 700,000 got cut off from water fluoridation, and it was political, as it is in all communities where water fluoridation is decided on a local basis. We developed, a few of us got together and decided it was time to take these battles on. we formed the American Fluoridation Society, named after our elderly sister organization in the UK, the British Fluoridation Society, which has been around for half a century now. And we work together hand in hand in helping each other around the world to fight these battles and provide science-based evidence on its fluoridation, whatever it has to say, and present it to decision makers to help them to understand the truth versus that which is personal opinions presented by others. I do not take a penny of income, neither do any of the others for the American Fluoridation Society. We work completely volunteer, and we do this because it is our time in life to give back to our professions and our families. Next. It is a real honor to be able to speak with all of you today. I have utmost respect for what you're doing and listening and hearing and learning about more about fluoridation and the scientific facts. You are the backbone of our water system in this country and our communities being able to have safe water by the water utilities providing safe drinking water to us. That is paramount, and that separates this country from most all others around the world, is that we take our tap water seriously. The presentation today will cover what is community water fluoridation and how it works, the benefits of fluoridated water, why community water fluoridation matters, the effective management of fluoridated water systems, and the community's role in protecting oral health. Next. There's many ways to improve oral health. Cavities are a multi-pronged, uh, it's a multi-pronged problem. There's not one single thing that leads to cavities. Fluoridated water gets to everyone in a community without changing a single behavior in their daily routine. Of course, we want everyone to brush with a fluoridated toothpaste, to floss, eat a balanced diet, attend regular dental checkups. But let's face it, families that are in the poorest categories may not even have a toothbrush in the home. They may not have a brush for everyone. One family may use a single toothbrush. That's hard for a lot of people to understand and to wrap their heads around. It's not hard for me. I was brought up from a poor background. If I couldn't scrape plaque off of my teeth with my thumbnail, I didn't think I needed to brush. That's not the case, but we want to continue to educate people in proper home care and diet, but fluoridated drinking water is the closest thing we have to a silver bullet, to a vaccination against cavities. Next. Let's talk a little bit about water fluoridation, about what it is, how it works, and why it matters. Next. Water fluoridation is the adjustment of fluoride in the water that's naturally present. It's in all water, in groundwater, it's in uh, surface waters, it's in wells, but it's typically not at the amount that's the level that will prevent for maximum cavity reductions. The maximum or the optimal amount is 0.7 parts per million milligrams per liter of fluoride. Sometimes it's more than that, needs to be adjusted down. Most times it's much lower and needs to have just a tiny bit of fluoride added to the water to give us a 25% cavity reduction across the board, no matter what your age, race, ethnicity, access to dentist, or your level of education. Everyone benefits the same. Next. I will go through a few of critic claims a little bit later, but this one I kind of wanted to throw out there at the very front of this. We have a tradition of helping protect our families from deficiencies in this country. We add and fortify foods to help prevent diseases. and folic acid and vitamin D, calcium and iodine. Those things are added all of the time, and people don't think twice about it. However, fluoridation is a very contentious issue and has been since the very beginning in 1945 when the studies began, and it showed a huge cavity drop in the United States. The courts have consistently heard challenges to fluoridation in the U.S. courts from those that oppose it. There have been 108 cases tried in the U.S. courts since fluoridation began by the opponents. 108 cases in the courts of last resort have never been ruled that fluoridation is illegal. That's 108. We have one in the courts right now, which you are probably aware of, where the anti-fluoride groups are suing the EPA. 108 to nothing as far as losses. This is most likely going to turn out the same way. Fluoridation is like chlorination. It is all about prevention. Next. The Mayo Clinic founders realized and understood well ahead of medical professionals, including some of my own family, that the head is connected to the body. And their founders said that oral health was one of their primary concerns when they founded the Mayo Clinic. They call it the window to our overall health, and they absolutely place medical health issues that are influenced by oral health, dental disease, periodontal disease as top priorities. We need to look at folks that are doing that and say thank you. Next. Let's step back for a minute and find out, when did we really know about fluoride? When did we discover its benefits on reducing cavities? And a lot of people that oppose fluoridation will like to tell you that this happened in 1945, that the companies that are producing products, whether it's phosphate for fertilizer, whether it is a product of producing fluorspar to etch circuit boards or whatever. There's several different methods for getting fluoride from rock. But here's the issue. Where did we discover it? Why did we even know that it was something positive? Next. In 1901, a dentist moved out to Colorado Springs. Now, let me quickly say that fluoride is everywhere. It's the 13th most abundant mineral in the Earth's crust. And as I said, it's everywhere in groundwater and surface water. And even our oceans have typically between 0.8 to 1.4 parts per million or milligrams per liter. Next. Frederick McKay was a dentist that graduated and moved out in 1901 to Colorado Springs, Colorado. He saw something there that he had not seen in his patients in dental school, and it was a brown stain that was on the teeth, and it was not easily removed if removed at all, no matter how much he cleaned those teeth. He started to look around and go, I'm not seeing it in adults that have moved in. And it really only shows up in people who've been here their whole lives, were either born here or moved in when their kids were very young, under the age of 8. And so he called his professors, and they kind of thought, looked at him sideways and thought maybe he was a little whacked out and didn't quite buy into it. Well, after a few years, he began to get interest from what's now called the U.S. Public Health Service to come and look at it. And one other thing that he noticed after a while was there are very few cavities in this population of people. Now think about 1901 and having very few cavities, and that's extremely rare and are almost unheard of. Next. The U.S. Public Health Service came out and worked with him, and over the next 30 years, they helped to look at communities around Colorado Springs where they found brown stains available or present. And they also began to look in other areas where cavities were low and the teeth were good looking, that maybe they had some little white streaks or marks on them that were only noticeable really under a bright dental light and by dental professionals. And they didn't know what was going on. They knew that everybody drank from the same water supply, but they didn't know what was in the water. They tested it and everything seemed normal. Well, the key was we didn't have a fluoride testing probe available at that time. That didn't come around until about 1930. But when that was invented, fluoride or water samples from Colorado Springs, as well as the communities where they had good looking teeth and very few cavities, were sent in. And they found that fluoride in the communities where teeth looked good and had low cavities was around 1 milligram per liter. In Colorado Springs, it was between 2 to 12 parts per million milligrams per liter. So now they had something that they could hang their hats on. We've got fluoride at a level that at a higher amount causes brown stains, no health issues, nothing wrong. People's heads were on backwards, no third eyes. But at a low level, there was a benefit. Well, that makes sense. There's a lot of things in our lives that have help at a low level, and they're therapeutic, and high levels are not. Next. So what happened was at that point is that they began to look at, and this slide shows the instrument that was invented to measure fluoride. Next. What was done was to test cities where we knew that fluoride levels were naturally present and test them against cities that did not have fluoride levels that were very high either. That was considered a test of 4 control cities and 4 test cities. And that was in, the first one was in the United States, was in Grand Rapids, Michigan. When fluoridated was initiated, no one knew how to prevent cavities. It was uncommon, not uncommon for 13-year-olds to have lost 1 or more permanent teeth due to decay. About half of older Americans over 65 had lost all their natural teeth. And in fact, to get into World War II, a person candidate had to have at least 6 teeth opposing, 3 on top and 3 on bottom, so they could chew food and be able to keep their nutrition up. 10% of those that applied to go into the military were rejected. 40% of them needed immediate treatment for relief of pain, and almost everybody had tooth decay. Next. Well, again, just repeating what I said a couple seconds ago, we thought, okay, let's see if we can replicate what Mother Nature did. She showed us that at high levels, fluoride was going to cause stains, and at low levels, 1 part per million, we had good looking teeth. Well, the 4 cities were picked to look at them. There were 3 in the US and 1 in Canada, as I recall, that they adjusted the natural fluoride levels in the water up to 1 part per million. And the other cities, they left them without any adjustment. It didn't take long that we began to see cavity rates drop dramatically at 60 to 70%. We now had replicated what Mother Nature had showed us, and we were on the race with trying to fluoridate our country to help rid ourselves of this horrible disease. Next. People many times will say, well, what are the alternatives to fluoridation? And this is specifically in cities where you have people on the decision-making group who don't particularly like fluoridation. They have their reasons. It's personal. It is not based in science, yet Politically, they may want to do something to help themselves get elected. It's called less government. And they will say, well, what about the alternatives? Since you say it's mainly children being affected, why don't we look at doing something else for those kids? Well, guess what? Community water fluoridation is the gold standard, the closest thing to a magic bullet, as I said, that we have. It reduces cavities for kids and adults, and especially adults, at a 25% reduction over their entire lives. Fluoride toothpaste is wonderful and we need to use it, but it's not a replacement for fluoridation. We have to have both to work hand in hand. Just as we had seatbelts, when airbags came out, we didn't stop using seatbelts. They worked in tandem. We continue to wear seatbelts and airbags to protect us that much further. Fluoride supplements are one of the only things that we have in areas that don't have water fluoridation, but it is a terrible option because it requires compliance. And studies have shown that compliance with fluoride supplements is about a 30%. 30% of the people comply with it. So it is not a good option. Nothing works as well or is as cost effective as water fluoridation. Next. What are the health benefits of fluoridation? Well, we know cavities are reduced for everybody. That's been proven and shown. Again, we still want you to do all the other things that you need to do to help take care of your mouth to help reduce them even more, including the addition of dental sealants. But if you do nothing else, fluoridation is a major improvement in oral health. Next. Oral health disease, common dental cavities are the most common chronic disease for children and teens. It's significantly more common than asthma, obesity, and diabetes. It is infectious and transmissible. Again, it's the most common chronic disease for children and teens, and it's infectious and transmissible. We give it to our children by kissing them. Our babies are born without bacteria that causes cavities. We kiss them with our mouths and we transfer our bacteria to them. They get it from other kids at school and playing with toys and saliva that gets on the toys, passing one to another, and also from their daycare providers kissing them. So they pass it on back and forth. Cavities are horrible. If you've ever had one, you know what it means. Again, I came from next to nothing and having monies when we were growing up. I had abscess teeth, and I did not know whether they were. We never went to the dentist. We didn't have the money to go to the dentist. They cause severe pain. It's hard to concentrate in school. It's difficult to eat. When adults have the same thing, they'll miss work. They absolutely cannot think well. They're in pain. They have swollen faces. And it is also a predictor of cavities later in life, and it's extremely costly to fix cavities. Looking at this young lady here, you might think she's been hit by a parent and she has a swollen cheek. She actually has an abscessed tooth. That abscessed tooth is in close proximity to her brain. There's a vein that runs from around the eye back up to the brain. Now, those veins normally have valves to prevent backflow. The veins in that area do not have valves. That swelling in her face from that infection has gotten into her muscles. It's gotten up under her eye, and you can see her eye is swollen. That's a critical sign that she's only a few inches away from that infection getting into her brain. And people die from brain abscesses every year. Next picture. These are two examples of people who have died from brain abscesses from a dental infection. And there are many, many people every year that die from this. They get reported as septicemia, they get reported as a heart attack, and somewhere down the toe tag, they said they have an abscess tooth. So they're way underreported. It's just something cavities are not a hole in the tooth. They are, but it's a serious infection and it needs to be taken care of. One cavity can result in someone dying. Next. The question comes up, is fluoridation still necessary? We have fluoride toothpaste. We have more fluoride available to us in mouth rinses, and we have fluoride available to us in products that are produced in areas where fluoridated water is used. Well, the answer is absolutely, without a doubt, yes. The effect of starting water fluoridation in a community reduces cavities by at least 25% in adults and children. At least. Next. Let's look at what happens when water fluoridation is stopped. Next. It's kind of exciting, but not so much. But we have good studies now that have shown us that fluoridation, when you stop it, will actually show how much cavity increases occur and what fluoridation was keeping down. There are 3 communities that have great data that showed us the horrible impacts of stopping fluoridation. One of them is the capital of Alaska, Juneau. Juneau had fluoridated water for years. It was a decision made by the local government, Juneau, Alaska, with opponents of fluoridation claiming all sorts of health ills, incorrectly and inappropriately, misinformation, but the council decided to stop it. Well, Juneau has a very stable population because it's difficult to get in or out of Juneau unless you have an airplane or you have take a ferry over to it. So what this researcher did was to look at Medicaid data from before fluoridation stopped and after. And what she found was that afterwards, you would get 1 additional cavity per year in kids under the age of 7 that those that had fluoridated water were not going to get. 1 more cavity per year. Doesn't sound like much. We'll talk about that in just a minute. Calgary, Alberta, Canada, stopped fluoridation in 2011, same time that my county stopped it. They're looking to restart it now. Calgary, in a matter of 3 years, when compared to a city that is to the north of it, Edmonton, which is fluoridated as well, the cavities in Calgary, when they stopped, skyrocketed 146% in just 3 years after they stopped it when compared to fluoridated Edmonton. Windsor, Ontario, Canada, stopped fluoridating in 2013. Their cavity rates were at a point where the city council, again, 8-3, voted to stop fluoridation. But they did something very nice. They said, let's look at what goes on during the next 5 years to the health department and said, come back and tell us. And this is key information that can be shown from public health statistics that you can keep and see what's going on. So the health department studied it for 5 years and went back in 2018, the end of 2018. I got asked to come help them with the opponents' claims because they, like all public health folks here in the U.S., cannot do something that can be construed as politically inappropriate. Going up against the opponents, using all sorts of things. That's where AFS comes in. They went back to the city council and they told them that during that 5-year period, there was an increase of 51% of cavities in the kids in 2nd grade, and they also had similar results in the adults, and 51% an increase in cavities and emergency procedures. Next. Excuse me. So just taking a look at Juneau, look at this at ages 3, 4, and 5. Let's consider we have a classroom of 30 kids in preschool during fluoridated water, and 30 of them after fluoridation was stopped. The group after fluoridation is stopped, the first year would have one more cavity each per year. So they would have 30 more cavities in that classroom than the other classroom in preschool or pre-care than the other class. The second year, they'd have an additional 30 for a total of 60 more cavities in the other group. Third year, they had 90 more. That is a huge, huge impact to a community. And we're not talking about just 30 kids in a classroom. We're talking about communities of hundreds of thousands. So that showed how much that fluoridation was stopping. Opponents like to tell you that fluoridation stops one cavity in 40 years. And that's just absolutely ridiculous and bogus. These studies show opposite and otherwise. Next. Cavities are definitely unevenly distributed. Families that have low-income kids are more than twice as likely to have cavities than those that do not, that come from means. The disadvantage bear a disproportionate burden of these cavities. Let's face it. Poverty rate in Louisiana is 18.6%. That's huge. You have a large population of families that are at double the increase, double the rate of cavity potential than others. I looked at your numbers as far as amount of fluoridation, which you had mentioned is 39% of community water systems are fluoridated. I looked at the number of community water systems and people on those that are not fluoridated. When you look at savings of water fluoridation to an individual, you save $32 per person per year in avoided dental treatment needs. $32.19 to be precise. Again, that doesn't sound like much to a decision maker, maybe. Well, consider $32 times the number of people not on fluoridated water in Louisiana, and that comes out to $82 million in a year that people are spending on dental treatment needs, untaxable dental treatment needs, that is not going into the economy. Fluoridating the water will reduce that. That $82 million all of a sudden becomes expendable or disposable income that's going to be spent in the community, that's going to create a larger tax base, that is going to be great for the communities. So not only is fluoridation benefiting people's health and people's livelihood, it's improving the economy as well. So you have multiple reasons for fluoridating the water at pennies per person per year. Next. One of the largest things that I can ever show those of us, and I visit water plants everywhere I go, and I do water fluoridation defenses and help all across the nation, not just in a few states anymore. I've pretty much visited almost every state. I got to be the president of our group when we were forming because I actually had to go to the restroom, and I came back and I was elected president for life and chief spokesperson. So I'm the mouthpiece for us that goes out and does this stuff. I have ADHD and anxiety disorder, but when my county cut it off to 700,000 people, I lost my anxiety and I became angry. And I said, you're never doing this again. So I'm not a spokesperson. I'm not a presenter, but I had been forced into the position, and I thank God that I had this opportunity. When you fluoridate water, the need to take some children to the hospital for treatment under general anesthesia is greatly reduced, greatly reduced. 4 studies now show that. Water operators prevent more cavities by fluoridating the water than all the rest of us can do in our lifetimes. And the person that stated that is our immediate past CDT fluoridation engineer, Kip Duchamp, and he's absolutely correct. Next. That child on the last picture, this is that child who has been taken to the operating room. It's been taken care of with teeth extracted, with silver crowns, beautiful things that they are on these teeth that will be there, many of them until they're 10 to 12 years old before they fall out. You have reduced by fluoridating the water 2/3 up to 3/4 of these children from having to undergo a general anesthetic simply to fix the teeth. Anesthesiologist, it drives them crazy. Jerome Adams, our U.S. Surgeon General, is a he's an anesthesiologist, and one of the first cases he had was a child laying on the table for him to intubate so they could fix his teeth. He was appalled. Thank you for fluoridating your water, and we need to increase this in Louisiana without a doubt. Next. It's a simple question. Which would you rather have? Truly, I live in a rural area, and these cavities on the left-hand side of your picture are not uncommon. Growing up with my kids in a fluoridated community, what you sometimes see will be little white streaks on the teeth. Remember the pictures I showed you before from when they were studying it to find out what was causing the white marks, and it is a little bit of extra fluoride when the teeth are developing. And on the right side, you'll see some little tiny white streaks. You can't really see them well. This is under bright light and flashes. But those kids on the right, those are my daughters basically, but they're not, but they look this way. They will have cavities. They will have less cavities. They will have less severe cavities. So there's a clear-cut choice between fluoridating and not fluoridating. An infectious disease on this one on the left side, which is rapidly progressing. The ones on the right side can be taken care of and help to even reverse some of these. Next. So we're kind of looking at it. We know that fluoridation is effective. And now we want to see, is it safe? Because you're hearing about safety issues right now with some of the new study that has come out. Next. There are groups around the world that study safety of water fluoridation over and over and over again. In England, every 4 years, Public Health England has to look at this by law of fluoridation's effectiveness and safety. Other groups look at it ever so often, the most recent being in the archives of toxicology, looking at is fluoridation water at fluoride levels, is it causing any health issues whatsoever? And they said absolutely at levels in Europe, which is 1 part per million is what they use, there's no evidence of any health effects whatsoever. Next. A study that came out of Canada last year was one that said that pregnant mothers who drank fluoridated water gave kids or their offspring at 3 to 4 years of age had reduced IQs. Now, the study itself, they were good researchers. The downside of it is they were not looking at these kids every single day. They looked at urine that was sampled through another study. They pulled those urine samples out and began to analyze them for fluoride content, which is not a great way to analyze fluoride in pregnant mothers or in anyone, but they did it. It's been shown in that study, which I'll go into in a minute, that study has several serious flaws and actually has been dismissed as a poor study. But the anti-fluoride group, Fluoride Action Network, petitioned the National Toxicology Program to take a look at fluoride in water and is it causing IQ problems. Ever since fluoride was added to the water in 1945, It's been considered and called a IQ issue where we are dumbing down our country so that the Russians can take over. If you've never seen the movie Dr. Strangelove, not Strangelove, the newer one, Doctor Strangelove, you need to watch it. I didn't realize it the first time I watched it, that movie was totally about fluoridation. I love the actors. I remembered this movie, but when it stopped in my county, people were saying this is just Doctor Strangelove. Went back and watched it, and the whole movie was about fluoridation and how the communists were introducing it into our water to make us dumb and take over the United States without firing a shot. Worthwhile rental. So the National Toxicology Program was petitioned by the anti-fluoridation group. They said, take a look at it because we've got all these studies, human and animal studies. They weren't studies they had found under a rock somewhere. These are studies that are out there, but they were poor studies. So they said, would you look at this and see if we feel that fluoride is a neurotoxin at levels in water fluoridation? So the National Toxicology Program put out a monograph on their review of fluoride exposure, neurodevelopmental, and cognitive effects. That study was then, or that review was then peer reviewed by the National Academy of Sciences, Engineering, and Medicine, and that's abbreviated NASEM. NASEM reviewed it, and they just shredded it for several reasons, and properly so. So they sent the NTP back to the drawing board. NTP went back and addressed some things that NASEM had really criticized them for, and they released a revised draft monograph in September 16th, 2020. Next. Well, the revised monograph came out, and they did listen to NASEM. And NASEM said, you are talking about fluoride levels at what we use in water fluoridation in the United States. And so you need to say whether it applies to water fluoridation or not. And when they came out with this revised revision, they said they did not find a relationship between neurotoxicity, IQ scores that is, and fluoride at the levels that are used for water fluoridation. They did say there was an association, not causation, association at levels at and above 1.5 parts per million, which is over twice of that of what we use in fluoridated water. Key is, again, NASEM is going to conduct a peer review of this NTP revised monograph. They heavily criticized it the first time because of the quality of research and analysis that NTP relied on. And there's very little that has been changed in this revised NTP release. So we expect a lot of criticisms again, but we want this to come out right. We want to know, but at least now they're saying fluoridation does not fit into it. The anti-fluoridationists are up in arms. They don't agree, but science is what it is. Next, please. Water fluoridation has a huge consensus of support, and not just from leading health and medical organizations around the world, but also from people like the American Water Works Association, Department of Defense, the CDC, Mayo Clinic, World Health Organization. Leading health and scientific organizations around the world support fluoridation as effective and as safe. There is not a single credibly recognized scientific or health organization in the world that opposes water fluoridation. Not a single one. These are people that look at studies. They're not a rubber stamp, as the opponents like to say. These are people that look at these studies and analyze them. It's safe and it's effective. Next, please. Remember what I said earlier about You had to have three opposing teeth on top and bottom, 6 teeth to get into World War II, and 10% were rejected. And we're a lot later than that now. We would think that we're a lot better. Well, Jerome Adams said recently that almost 50% or more of Army recruits cannot be deployed because of their dental issues. This is a national security problem for the United States. It is our troops not being able to be deployed, ready to be deployed into a active hotspot. Those that are deployed, it is a serious issue to a mission when one of them develops a toothache and has to be airlifted out of a hot zone by a crew that could be shot down and killed in their helicopter, and to the troops on the ground. It is a serious dental problem, and water fluoridation is mandated by the Department of Defense for all U.S. bases in the world that have their own water supply and over 3,300 people on it. It is a directive, I should say, not a mandate. It's a directive, and that means it has to be done. And this is exactly why we have to keep our armed services folks healthy, and water fluoridation does just that. Next. The clear weight of evidence, again, the groups on the left are no slouches. These are people that are studying the science all over the world. And scientists are the worst people in the world. And why? Because they argue with each other. They are critical of each other's information, and they challenge each other. They're not awful. That's how science is done. This group in Canada, they still have not released their information, their data, for anyone else to look at. They refuse to do it. And that's not how it's done. We paid for it. US taxpayers paid for it. Our National Institute of Health funded that study. Everybody that does research shares their data. One other person did this. Others have. But one other key person is Andrew Wakefield, the one who said that immunizations caused autism. He would not share his data. After several years, it was accessed, and it was found that he cooked the books. He lost his license in England. He is now in the US promoting anti-vaccinations. His article was published in a lead, if not the top medical journal in the world, Lancet. They retracted his article after the truth was found out. And again, going back to the Canadian study, I won't say that this is an Andrew Wakefield type of a situation, but it smells wrong. You don't release your information for other people to analyze it, which is commonly done and expected. Then you're suspected of hiding things. And even though it was published in JAMA Pediatrics, it is being looked at as, we need this data. And it's been a year since it was demanded by 30 international researchers to the NIEHS, National Institute of Health, Environmental Health Sciences, and they still have not given it back. Next. Next. To summarize, community water fluoridation is effective at reducing cavities, needless pain and suffering. It's safe. It saves money for the entire cost the person and our healthcare system. It prevents cavities that everyone in the community gets by just simply turning on the tap. And it's recommended by the most respected health and medical organizations in the world. Next. A few more points. Opponents like to say that the National Research Council 2006 report showed that water fluoridation is harmful. Well, what that report actually did is that they found no definitive evidence of any health effects on the body other than discoloration of tooth enamel. Next. They also distort the facts about dental fluorosis. Again, that was the only thing that was found in that study, in that research document. Severe dental fluorosis on the bottom right is brown pitted staining. That does not occur by water fluoridation. The two types that are increased slightly are very mild to mild fluoride or fluorosis. Those are just little white streaks on the teeth that you can barely see, and it eventually wears off of the teeth. Moderate fluorosis, next slide. Moderate fluorosis occurs from the improper use of fluoride products, in other words, swallowing toothpaste. Let's look at fluoridated tap water versus bottled water. Opponents will like to tell you that the Food and Drug Administration does not allow for fluoride to be added to water. Next slide. Well, that's absolutely incorrect. The FDA does approve fluoride for use in bottled water for cavity reductions, as these products show. The EPA has jurisdiction over the drinking water, not the FDA. And in fact, bottled water has bacteria in it. It is not controlled under strict guidelines that the EPA controls tap water. And in fact, a couple of years ago, bottled water for nursery bottled water was found to be contaminated with mold in a large chain of grocery stores and had to be pulled off the market. People who have health issues, organ transplants, immunocompromised, they are absolutely told not to drink bottled water because of potential bacterial infections that can occur. But the point being, the FDA does say fluoride absolutely stops cavities. Next. Another claim that they love to say, opponents, is that 97% of Western Europe has rejected fluoridated water. Play on words. Fluoridated water reaches 13 million people in England, Ireland, and Spain. Fluoridated salt is also used where you cannot have the infrastructure to deliver water to everyone, into over 75 million in Germany, France, Belgium, and other countries. And when countries don't have the availability for fluoridated salt or waters, some will use fluoridated milk or fluoride rinses, and they have targeted fluoride programs for children. Again, fluoride in the water reaches everybody of all ages. Programs that are targeted to children do nothing for adults. Fluoridated salt reaches everybody, but again, the gold standard is fluoridated water. Next. The critics of fluoridation also love to distort the World Health Organization data. They will tell you that cavity rates were coming down across the world at the rates that were in fluoridated countries as well. And they'll show you the slide of the World Health Organization data on the left. Look at when these points were begun. It's like in the between 60 and the 80s, 83, they began to come down. Well, the data was manipulated by a group of anti-fluoride researchers to make them linear. You can't do that with science, but they did it. So taking it to the next slide, I will show you that when the same data was looked at by, excuse me, for the country of Ireland. Next slide. When Ireland looked at it from the same World Health Organization data, this was apples to apples. Because again, starting a little bit before 1984, they saw cavity reductions, the top line, in their non-fluoridated areas, but where they had fluoride in the water, they saw another 25% reductions or more in cavities. Now, what happened in that time right before 1984, late 70s? Fluoridated toothpaste was introduced. That's the game. It came down everywhere, but when you add fluoridated water on top of it, they work together to give you an additional 25% cavity reductions from the fluoridated water. It's all a play on words and terms to trying to confuse decision makers. Don't be fooled by this. Next. Opponents also like to say communities are putting an end to fluoridation. Well, guess what? Every year since fluoridation has been in place, we have increased it in the United States since 1945. As of 2018, we have over 207 million people on community water systems that have access to optimally fluoridated water every year. And as you said, in Louisiana, that is 1.6 million people on community water systems that are receiving optimally fluoridated water. We need that to go up. Our general health of our population in Louisiana is suffering because of suffering oral health, and their economic ability to earn more monies, to be able to get better jobs, are affected by the way that their teeth look. That's a fact. Next. Challenges happen all the time. Next. They're very organized in how they challenge. They look at far right and far left groups. It can be Republicans, it can be Democrats, it can be independents. And it is people who are wanting to say less government. Now, the opponents are relatively a small group of people, and they've been that way since 1945. But along came a spider called the internet, and that allowed them to have a major voice. They are absolutely perfect at distorting research, misrepresenting information in credible scientific journals, spreading misinformation and fear. Right now, they're spreading it to pregnant mothers that they're creating babies that are basically dumbed down from drinking fluoridated water when they were pregnant. And that is godly unforgivable. That is just, I cannot even begin to tell you how angry that makes me. What they do in a nutshell is they take tidbits of information pulled out of credible science, they mix in their own opinions, and they twist it into a KitchenAid blender and mix it up and pour it out over an unsuspecting population. And people have to try and figure it out on their own. Well, people, they depend on our decision makers. They elect them to make the tough decisions. And this is not a tough one. When no one in the world that's credible health or scientific organization opposes it, CDC backs it, American Academy of Pediatric backs it, ADA, on and on. It is an easy decision, but they do make it hard on themselves. Next. So now we've shown that there's no health effects, that it works. So what are we left with? We're left with back when we saw 1901, the spot on the tooth, dental fluorosis. What is dental fluorosis? Next. Dental fluorosis is a color change in the appearance of the enamel of the tooth caused by a higher intake of fluoride during the tooth forming years that shows up as some sort of a white mark on the teeth. Next. Dental fluorosis is typically mild in its cosmetic effect. It does not cause the tooth to have a problem with pain, eating, and actually most people don't even notice it unless you're a dentist. Next. There should have been one on the other slide. So I'll repeat it though. It does not occur after the age of 8. It only occurs during the time that the permanent teeth are developing under the gums in children. That's when the fluoride gets into the enamel of the teeth. It does not occur afterwards in adults. This review by the EPA's National Research Council that was done in 2006 found that only definitive finding was that at 4 parts per million, severe dental fluorosis, that yellowish brown stain, was the only thing that showed up. They also said at 2 parts per million, which is a secondary maximum contaminant level, the 4 milligrams per liter is a maximum contaminant. level at 2 parts per million. Severe dental fluorosis was virtually zero. And we know that at 0.7 parts per million water fluoridation, no severe fluorosis occurs. Next. What is the community's role in protecting oral health? Next. Well, we know the stuff works. We know fluoridation stops cavities above and beyond what toothpaste does and other topicals. And we know 3 out of 4 residents in our country, nearly 3 out of 4, have fluoridated water every single day. Next. Folks, you got to get involved. You cannot sit back. This is not someone else's problem to take care of. I thought it was. I was naive. When my county got challenged, I thought CDC is going to come in, ADA is going to come in, American Dental Association. Well, guess what? They are not there. The ADA says the local dentists are the ones that should be fighting this battle because they're local. Well, we aren't trained how to fight this battle in dental school. No one is, because opponents use conspiracy theories and pseudoscience. We're not taught that. We're taught that fluoridation works, and we know it. But we get out and we hear these theories, and they sound believable. Well, we had to make ourselves knowledgeable of why those are wrong. You also have to talk to our public water system decision makers. And you got to talk to our elected officials and discuss things with them. We are educators. We have to help them understand why oral health matters, and we need to get their ideas on it, where they stand on it, and help them to understand if they're against it. Be open to their questions and concerns. Sometimes, they don't many times know about fluoridation. They have jobs. These people don't just work for the city council. They've got a daytime job. They've got a hardware store, a grocery store, a liquor store. They're a stay-at-home dad or mom. They've got jobs other than this time that they put in on making these decisions. We have to share with them the information that they can't just pull off the internet. We have to share the credible information with them. You don't have to know everything about it. That's what we're here for. You've got the ADA. You've got the Campaign for Dental Health, which was the American Academy of Pediatrics group. You have the American Fluoridation Society at your side all the time. We are here to help you and help those in these situations to understand how to approach it and to coach you. Next. It takes a village, folks. It's not going to happen by just any one person doing this. Our water operators and engineers are just phenomenal. I will tell you that there are some that are opposed because they don't believe in it. They try to sometimes get it stopped, and they are the water experts in the community. Just like the building department are the experts on buildings, infrastructure is the same way. So when a water operator who opposes fluoridation goes to the city council or county commission and says, I don't think we need this anymore because this, and this, they get a lot of traction with that. We have to be the ones to be proactive and go and talk to our leaders and talk to our water operators. Let them know how much we appreciate what they're doing. You all are providing safe drinking water for us. That is what keeps us from being sick in this country, keeps us from being sick like people who come from other countries and are afraid to drink our tap water. They drink bottled water, which is worse for them because safe drinking water is absolutely the best water that we have in this country. You have resources from the CDC, American Fluoridation Society, American Dental Association, American Academy of Pediatrics for engineers and for the public and for all of us on this call. We are here to help you anytime. When you need boots on the ground testimony, when you're running into problems, we're here for you. We have, I hate to say subject matter experts because that's like patting ourselves on the back, but that's what we make ourselves to be. We know everything that's going on because we have a lifeline to all researchers in the entire world who will have an answer to us within 12 to 24 hours of a claim that's made against their research. That is what the internet has done for us. And we are so thankful and appreciative of it. But the ground battle begins with you. You hear something from a neighbor, you hear it over a backyard fence, you hear it in a grocery store, in a letter to the editor. By the time you hear it, there's an issue going on. Somebody's trying to cause a problem in your town. Get out in front of it. Let the health department know, and they know how to get in touch with me. And I can help put into place people at the American Academy of Pediatrics, CDC, American Dental Association. We have a network, folks, and we don't let it rest, and we're there with you. We want to see Louisiana go forward and have healthier people and healthier bodies. Next. This ends the presentation at this point. Now, I want to let you know, this is like a part one of what we're going to be having another part at the Louisiana Oral Health Summit in March. Maybe virtual, it may be in person, but we are going to continue to build on this and have a deeper dive into this subject matter. This is touching on it. It's hard to do in an hour. I could talk for 3 days solid. Just ask anybody that knows me. But I absolutely love this because when I was a kid growing up with ADHD, I was a brat that nobody wanted to be around. Now I can be a brat for a good reason, and I will never back away from a fight anywhere. If you have questions, please do not hesitate to call on me. My phone number is my cell phone, email address. You can get in touch with me anytime, day or night, 24/7. Thank you all very much for being here, and I really appreciate the opportunity to work with you all. Thank you.
Thank you, Dr. Johnson. So in Louisiana, we have a fluoridation toolkit. Act 761 passed in 2008, which mandates that water systems with over 5,000 connections initiate water fluoridation. Wellhead, Louisiana provides a fluoridation toolkit for adjusting public water systems. It also includes guidance standards for initiating and continued operation procedures for reporting and inspections, as well as additional information. Our community water fluoridation website also provides additional resources on general community water fluoridation information, as well as for those systems that are interested in learning more about initiating. Our contact information is listed here. For more information and resources, please do not hesitate to reach out to the Wellhead, Louisiana using this contact information. And this concludes this webinar. Thanks again for joining.